Hello everyone and welcome back to our channel. If you're new here, this is Easy Psychology 101 and I'm a psychologist dedicated to breaking down the complexities of mental health so that you can better understand yourself and those around you. Today, we're diving into a topic that is incredibly important yet often misunderstood: mental illness. We'll be discussing different mental health disorders, their symptoms, and the treatment options available. What's mental illness? Before we delve into specific disorders, it's crucial to understand what mental illness actually is. Mental illness refers to a wide range of mental health conditions, disorders that affect your mood, thinking, and behavior. Some of the most common mental health disorders include depression, anxiety disorders, schizophrenia, eating disorders, and addictive behaviors. These conditions can be long-lasting, chronic, or they can come and go, episodic. They can affect anyone, regardless of age, gender, or background, and they are more common than you might think. According to the World Health Organization, 1 in 4 people in the world will be affected by mental or neurological disorders at some point in their lives. Let's start with one of the most well-known mental health disorders: depression. Depression can manifest in several ways, including persistent feelings of sadness, hopelessness, and a lack of interest or pleasure in activities you once enjoyed. You might also experience changes in appetite, sleep disturbances, fatigue, and difficulty concentrating. Depression is often categorized into different types, such as major depressive disorder, persistent depressive disorder, also known as dysthymia, and bipolar disorder, where depressive episodes alternate with periods of mania. But here's the good news: depression is treatable. Common treatment options include psychotherapy, such as cognitive behavioral therapy, CBT, medication like antidepressants, or a combination of both. In more severe cases, treatments like electroconvulsive therapy, ECT, may be considered. Next, let's talk about anxiety disorders. While it's normal to feel anxious from time to time, people with anxiety disorders frequently have intense, excessive, and persistent worry and fear about everyday situations. This anxiety can interfere with daily activities and be difficult to control. For instance, people with generalized anxiety disorder often feel anxious about a wide variety of things: money, health, work, or relationships, often without a clear reason. Panic disorder, on the other hand, involves sudden and repeated episodes of intense fear accompanied by physical symptoms like chest pain, heart palpitations, dizziness, or shortness of breath. Treatment for anxiety disorders often involves a combination of psychotherapy and medication. Cognitive behavioral therapy, CBT, is particularly effective as it helps individuals identify, understand, and change thinking and behavior patterns. Medications like benzodiazepines or selective serotonin reuptake inhibitors, SSRIs, may also be prescribed to help manage symptoms. Now let's turn our attention to bipolar disorder. Bipolar disorder is characterized by extreme mood swings that include emotional highs, mania or hypermania, and lows, depression. These mood swings can affect sleep, energy, behavior, and the ability to think clearly. There are different types of bipolar disorder, including bipolar 1, bipolar 2, and cyclothymic disorder. We will explain everything in detail in the coming videos, so stay tuned. Schizophrenia is a more severe mental health disorder that affects how a person thinks, feels, and behaves. People with schizophrenia may seem like they have lost touch with reality, which can be distressing for both them and their loved ones. Schizophrenia is characterized by symptoms such as delusions, hallucinations, disorganized thinking, and extremely disorganized or abnormal motor behavior. These symptoms can be disabling and often require lifelong treatment. Treatment for schizophrenia usually involves a combination of antipsychotic medications and psychosocial therapies. Cognitive behavioral therapy can be beneficial in addressing the symptoms and helping individuals manage their condition. In some cases, hospitalization might be necessary to stabilize severe symptoms. Lastly, let's talk about personality disorders. These are a group of mental health conditions characterized by unhealthy patterns of thinking, functioning, and behaving. People with personality disorders may have trouble perceiving and relating to situations and people, which can lead to significant problems and limitations in relationships, social activities, work, and school. Some common personality disorders include borderline personality disorder and antisocial personality disorder. I hope I made them easier for you guys. And if you have any questions or inquiries, feel free to contact me anytime. Remember, I'm here to help you. So if you liked the video, please like it and subscribe to the channel because that helps me to keep going. See you soon.